With tools like beakers, Bunsen burners, and microscopes, our next rewarding career opportunity in healthcare takes the skills of a research scientist. The work can vary for someone who works in laboratory services. The team from Memorial Health Systems in Abilene goes into the lab to share the career opportunities and options available in a medical lab.
At Memorial Health System in Abilene, we work as a critical access hospital. We've got 25 beds, our own laboratory. Laboratory consists of multiple different departments. So you got your phlebotomists, they're bringing the specimens into the lab. Then you got chemistry, it's the workhorse of the lab, that's where most of the testing is done. Hematology, very specific, where it's just dealing with your actual red blood cells, white blood cells, platelets. Then you've got microbiology, dealing with all the little microorganisms. And then blood bank department, that's where we can safely maintain blood for patients who need it.
A phlebotomist is a person who does collections. Any bodily fluid, mostly blood. It's very easy, start to finish. It's probably only 3 minutes, but it's a nice, fun process, a nice little start to our day, and hopefully their day. I can't tell you how many times we've been complimented on not only how fast we are, but how painless it's been. And I think a lot of that has to do with our demeanor, because a lot of us are very open, very talkative. We remember their family members' names. So even though we're doing like phlebotomy, it's a little more than that, and they trust us. As a phlebotomist, when you learn how to stick, sometimes they have these artificial arms that you can practice on, which are great, but sticking an actual person is better. But you can do on-the-job training for this. You don't have to go to school first to be in this job. It is very attainable as long as you're willing to learn. Anybody can come do this.
In the chemistry department, that's where you're dealing with multiple different bodily fluids. You've got plasma, serum, urine, spinal fluids, and you're basically just checking for a wide range of different tests depending on what the doctor's looking for. Chemistry can be split up into a couple different responsibilities. If you're working day shift, primarily your job is to get results out to providers and interpret those results. That's where the education comes in. You need to be able to make sure this result you're giving a provider is valid, and ultimately that's going to lead to how that provider is going to treat your patient. If you're working on a shift, say second shift or night shift, where the workload is a little bit less, your responsibility is going to primarily be maintenance. So you're doing the routine cleanings, the tweaks here and there. That's going to make sure day shift is functioning smoothly, giving accurate results. Again, that's probably one of my more favorite aspects of chemistry is when something isn't working. I really enjoy the troubleshooting aspect of going from broken to fixed. It's very satisfying.
Hematology, we look at the red blood cells, the white blood cells, and the platelets. We're looking for abnormal cells, we're looking for normal cells. If we see abnormal cells, we can send it off to a pathologist to review to see if there's further problems or further testing that needs to be done. We also, in hematology, do what's called sedimentation rates, and that's how fast the red blood cells settle and looking for inflammation. We do coag or coagulation to see how quickly or how long it takes for your blood to clot. Hematology benefits patients by helping doctors diagnose and get right treatment at the right time. For example, with white blood cells, the instrument looks at them first, and then it'll flag and say, hey, there's a problem here, we need a set of eyes, take a look at this, and then we count 100 white blood cells. We differentiate what each cell is, and if we see any abnormals, we send it out to a pathologist for review that they may be able to see cancer that way. We can also help people if they have platelet disorders. We can see that and help them get more testing to further diagnose and see what the problem is and what treatments they can do. And then red blood cell morphology tells us a lot. It tells if someone's anemic. It'll tell if they need a blood transfusion. If their hemoglobin's too low, they don't have enough blood, they're not getting enough oxygenation throughout their body. Microbiology, we get to identify the bugs or the organisms that are causing infections. We do urine cultures the most, but we also do wounds. When we have, for example, a urine that needs cultured, we plate it and we let it grow until the next day. And then the next day we look at the Petri dish to see if there's any organisms, any bacteria growing on the dish. And once we see what we want to see or don't see, if we don't see it, that's good for the patient and we can just set that aside. But if we see growth, we want to identify it, and we do that by a multitude of tests. For example, there's an oxidase test, a catalase test. You have your gram-positive bacteria, your gram-negative bacteria. You treat them differently in how you identify them. We run the microscan is the name of the instrument we use that identifies and gives us sensitivities to tell us which antibiotics work and which ones don't. Therefore, a doctor will know if the patient's on the right antibiotic or if they need to make a change.
In the blood bank department, a majority of what we do is determining blood type. We can do that by taking little segments off of the donor unit, make a red blood cell suspension out of it, and then from there we can use our pipettes and aliquot a specific amount into gel cards. The gel cards contain antibodies that react with the antigens on the red blood cells. Based on how those reactions occur, we can determine what the donor's blood is. Blood bank's very important to our patients because it's a life-saving treatment. If it's not done correctly, it could harm the patient. So it's very important that we are determining donor blood is compatible with the recipient before we introduce that donor unit to the patient.
I love my job. I love what I do. I like working with my hands. I'm not really a desk kind of person to sit at a computer or do paperwork. So I love working with my hands. I love variety. I work at one station, then turn around, go to another station, and it's never the same thing twice. So it's fun.
There's a lot of different ways that you can get into the lab field. A lot of people start off with being a phlebotomist or a lab assistant. All you need to do that is just a high school degree, or you could go straight to school, become a medical lab technician with a 2-year associate's degree. 4-year degree will get you up to a MLS or medical lab scientist. And once you're in the lab, you're not really just stuck being a tech or being a phlebotomist. There's always different ladders you can climb. Just because you're not face-to-face with patients every day doesn't mean you're off in a room by yourself. Here at MHS, we've got a great culture. We laugh, we joke around, we have a great time with each other. There's also internal customers that you're going to work with on a day-to-day basis. You're working with nurses, you're working with doctors, you're working with radiology. The lab really interacts with all departments within a hospital.
Well, I think if you are considering a career in lab, starting as a phlebotomist is a wonderful way to do that. It gives you a baseline of what you'll see, you know, what you're going to do on the daily or what you could potentially be doing, either staying where you are or, you know, leading up to that. So you get to see everything that you're going to do and realize that you're not only just in the lab, you're not only just drawing blood or just collecting urine samples. Like, you get to do a lot of really cool things.
Let's hear from a laboratory services expert about the career opportunities working in a medical laboratory. Joining us this morning from Memorial Health System in Abilene is Trevor McKee. Good morning, Trevor.
Hi, good morning, Cindy.
Well, I wanted to start off with a story. Maybe you could tell us what really got you interested in working in the lab.
My origin story is kind of funny. Let's see, I was in high school. My mom said, hey, go be a lab tech. I got friends who do it. They love the job. They're comfortable with the job. And I ignored that feedback for about 10 years. And then it came back to me. I decided, yeah, let's give it a shot. And I went through the schooling and now I'm happily a tech 7 years later.
Well, thank you, because as a mom, that makes me feel good that that advice finally, soaked in. So that's great to hear. Well, I'm curious, as I'm sure many students on the call are, can you share a particularly challenging or interesting case that you have worked on as a medical laboratory tech?
Well, I do have an interesting story. There's a disease called hemochromatosis, and basically it's where your body's absorbing too much iron from the food you intake, and it's storing that in different places of your body. This particular patient, it was showing in their skin and gave them a metallic, almost shiny skin tone. So we were able to see that in their labs. We got it back to the doctors. They were able to implement treatment and help this patient out.
That is an interesting story. It reminds me of different movie scenes I've seen. So thanks for sharing that. Now, I know there are lots of other questions potentially coming from students across the state. And if you are watching and haven't had a chance to use that chat feature, we encourage you to put your comments in the chat feature, and we can get those answered by our panels today. So Jaron, what kind of questions do we have for Trevor in the chat?
Yeah, good morning, Trevor. Thanks for being here. We have several questions, and maybe we'll spend a minute or two on phlebotomy. A lot of students are interested in that being kind of an entry point into the laboratory department. And so the first question, what is the youngest age that you can start working as a phlebotomist?
Uh, it's really going to come down to the facility and maybe some of the state regulations. Here in Kansas, we don't have, you don't have to be certified to be a phlebotomist. So most employers are going to at least look for a high school diploma or GED, but there is no law that says, hey, if you're 16 years old, you can't start on the job training to be a phlebotomist or a lab assistant.
Great. And then how many patients on average does a phlebotomist see every day? But also maybe you and your other colleagues, how many tests are you running on a daily basis?
Again, that's going to come down to the facility. If you're working for a bigger hospital, obviously you're going to have to see a lot more patients through the door. I'd say here at Memorial Health System, we're probably seeing anywhere from 20 to 40 patients a day. We also have ER outpatient services that are sending patients our way, or we're coming by their departments to draw blood.
And next, let's go to another one here. What would you say is the hardest part of your job, and what is the part of your job that you find most rewarding or the best part?
Hardest part of the job is probably whenever you're, and this is probably more for the phlebotomist because they're dealing with the patients face to face. They're seeing patients come in daily, weekly, monthly. Uh, it's hard whenever you see the treatments not work out, because you really get connected to those patients and you want to see the treatments work, and um, that's not always the case when it comes to life. So, and then on the flip side, when those patients aren't showing up every single day or every week because those treatments are working, you miss them because you get connected to them, but you're happy that the doctors found the cure and that our services are no longer needed.
Yeah, that's a good point. Thank you, Trevor. Another one, who oversees you, the department, and helps everyone work together and really integrate with the rest of the hospital?
The lab is overseen by a medical director, preferably it's not a phlebotomist, preferably a pathologist, but doesn't always have to be a pathologist. It's just a medical director, a doctor with an MD, oversees the lab. Um, as a buffer from lab to different departments, you're gonna have your lab manager who works to sort of uh, be the face of the department while the staff is working behind the scenes.
Another one that we just got in, how long does it take to get results from someone's blood after you draw it?
That's going to depend on the test. CBC, in the video we talked about hematology where we're looking at your red and white blood cells. As long as there isn't a line ahead of that particular patient, we could draw that blood, we could pop it on the machine, and we can have results for you in a matter of 5 minutes. Depends on the results. If those results require manual differential, and we got to make a slide and count those 100 cells, it may take a little bit longer to get that result out the door. But it's going to vary. It depends on the test.
And you mentioned a few of the tests just now, and I think some in the video, but overall, what are some of the common tests? Are there, standard tests that the laboratory department runs on a typical patient coming through the door? And are there others that are more, used in rarer circumstances?
Your common bread and butter lab test is your CMP, your complete metabolic panel, it's kind of your general check all, checking different organ functions and your electrolytes. CBC, your complete blood cell count, looking at those red and white blood cells, your analysis, those are your more common day-to-day tests. And then from there, you can dive into more specific tests that deal with like autoimmune diseases or other diseases that require more complex instrumentation, and those tend to go to bigger hospitals or reference labs, and you'll see a longer turnaround time on those kind of tests.
And that raises a good question as we go into our last, I think, two questions here. Are there places to work other than hospitals, but in the laboratory? And I think you just mentioned maybe some other centers that might be the answer to that question.
Yeah, my preference is going to be the hospital because you're going to get a lot of variety and see different things. But you can work in a clinic. That's going to be kind of more same stuff, different day kind of thing, where you're working 8 to 5, same tests every day. And then you've got reference labs where they're really just dealing with volume and lots of tests. There's pathology labs where it's very specified testing. So there's a lot more than just hospitals.
Yeah, and then our final question, Trevor, what skills would you say someone in your career field would need to be successful in it or enter it if somebody's watching and wants to pursue laboratory?
Probably the two most important skills for somebody in lab. You're definitely gonna need to have good customer service skills because you're working with internal and external customers. Your internal customers being other departments of the hospital, external customers being our patients. So you got to make sure you have great customer service skills, and then you need to be able to adapt and troubleshoot. I'm going to kind of ball that up into one because if your instrument goes down, you need to be able to adapt to that situation, figure out what's wrong, get it up and running so we can get those results out.